Hello and welcome. My name is Mary Rose Somariba with Natural Womanhood, and today we're sitting down to interview Dr. William Williams. Dr. William Williams is the editor-in-chief emeritus of the Lineker Quarterly, the oldest continuously published bioethics journal, and also is adjunct professor at the University of Pennsylvania and CEO of Bria Cell Therapeutics Corporation, which helps with breast cancer research. Thank you so much for sitting down with us, Dr. Williams.
Thank you, Mary Rose.
Thank you. So can just to start right in, jump right into your work in medicine. How did your work in rheumatology and and other medical, internal medicine, how did that help you become aware of birth control side effects?
So as a rheumatologist, there's a very common problem that patients run into with lupus, and especially those with what's called antiphospholipid antibody syndrome. This is a condition where people have a higher propensity to form blood clots. And it's been known for a long time that birth control pills can really make that a lot worse. And so I knew for a long time that there were clearly issues with birth control pills in patients who already had diseases. But it wasn't until I started to really look into the literature that I realized that these hormonal contraceptives can also predispose to the development of diseases. And that's kind of what we're focusing on in our Citizens Petition.
Right, and speaking of the Citizens Petition, for those viewers who haven't yet been informed, the Citizens Petition, there's a Citizens Petition to the FDA for greater transparency about birth control side effects. It calls for more awareness, black box type warnings, but also some other recommendations. Can you describe a little, for those readers who are just first hearing about this, the aim and scope of that Citizens Petition that you worked on?
Sure. So the scope of the petition is to ask the FDA to update the prescribing information as well as the patient information leaflets on all hormonal contraceptives to include many risks that are not acknowledged, and to provide clarity on several risks that are really poorly communicated in the current prescribing information or outright communicated in a deceptive manner. And we also asked them to withdraw Depo-Provera or depomedroxyprogesterone acetate from the market because it has its own unique problems that I know we'll get to a little later.
Well, we can go into that now. So, yeah, Depo-Provera, which is a very common shot, a birth control shot option. Women are recommended if they don't want to quite get a device or if they don't want to take the pill daily, they can go this shot route with Depo-Provera. Can you explain why that method stands out in your research as one, in the research that you included in that petition, as one that should no longer be distributed?
Yeah, so one of the co-authors of the Citizens Petition is Dr. Joel Bryn, and he had done some research looking at all the clinical studies that are out there on DMPA, Depo-Provera, and the risk of developing HIV infection. That's human immunodeficiency virus, the virus that causes AIDS. And all of these papers had been published over the years about DMPA and transmission of AIDS to women. And it clearly increases that risk. And that appears to be a unique effect of DMPA above and beyond all the other side effects that are not necessarily acknowledged in the prescribing information for a lot of these contraceptives. So it really didn't make a lot of sense for DMPA to still be out there on the market when it's got this unique and very serious risk associated with it. And when there's so many other alternatives, some of which are much, much better, as we'll be talking about later, like fertility awareness-based methods in NFP.
Yeah. And, you did mention a little bit about the transparency just before Depo, when we were talking, and how some of these prescriptions they can be outright misleading. Can you give a few examples of that, of how some birth control methods may have misleading side effects information?
Yeah, I think there's two that jump to mind right away. One is the risk of, serious blood clots and, things like heart attacks and strokes that women can get because of being on birth control. And if you look at the prescribing information for some of the commonly prescribed combined hormonal contraceptives, or birth control pills, basically, the way they have the information set up in the prescribing information, they show the incidence of clots, for women broken down by different ages, and they show it for women who aren't on the who are not on the pill, and then for those who smoke who are not on the pill, and then those who are on the pill, and then those who smoke and are on the pill. And because it's set up that way, there's this huge increase in risk with smoking, and it basically minimizes the risk for the hormonal contraceptive. But if you actually do it in the right order, so women not on the pill, not smoking, versus women not on the pill who not smoking, there's an increase in risk. And then women who smoke and are not on the pill versus women who smoke and are on the pill, again, there's another huge increase in risk. So it's clear that the pill has a problem here, whereas women tend to get the message, and this is very, very common out there, don't smoke and take the pill. Well, that's true, but the message really should be, don't take the pill because it can cause these blood clot problems. And the other one is breast cancer. Very commonly, you'll see in prescribing information that there may be an increased risk in breast cancer, although that's disputed in different studies, but that the risk tends to get less the longer someone's off the pill. So that really kind of minimizes the whole risk profile of breast cancer with the pill. They're first of all saying, well, the studies are kind of, plus or minus, which is not true. And then they're saying, and if you get off of it, then that risk will go away. So really very, very deceptive.
Yeah, and speaking of breast cancer, because I know that some of your work really helps with therapeutics in that area, but and the FDA Citizens Petition contains a lot of the studies that show the connections. Can you speak a little bit about those connections? I hear a lot about those denials of those links, and people are acting like it's disputed, but there is an established risk. Can you tell us a little more about the data about the what happens to the breast tissue, or what causes that risk, and the science behind it, but also the data and what has been found?
Yeah, so just to go a little bit into the science, to get cancer, you kind of need 2 or 3 things to happen. First thing is you need cells that are growing and dividing, and that kind of sets them up for having a mutation happen. And then if you get a bad mutation, then the normal cell, which was growing and dividing, can now become a cell that doesn't stop growing or dividing. In other words, a cancer cell. And what birth control pills do is a couple of things. So first of all, when a woman gets pregnant and then eventually lactates, what will happen is that the normally growing mammary gland cells will differentiate. In other words, they'll mature and they'll basically stop growing. So that reduces the risk of breast cancer. Something that people don't commonly know is that when you get pregnant and carry your pregnancy all the way to term, and then, especially if you breastfeed, that'll markedly reduce your risk of breast cancer. But on the other hand, the birth control pills, first of all, prevent pregnancy from happening, but then also they also stimulate this proliferation or this dividing and growing of the mammary gland cells, the breast tissue cells. And so because of that, they kind of give you that first setup for getting a mutation that's going to later cause breast cancer. So that's the theoretical part of it. In terms of the actual data, there have now been dozens of studies done. And while not all of them are statistically significant, with the exception of, I think, one study out of really over a couple of dozen studies done that I'm aware of, they all show an increased risk of breast cancer with combined hormonal contraceptives with a birth control pill. And, this is, for many years, people said, well, we'll just change the pill and reduce the amount of estrogen. And they came up with the so-called mini pill, because the first generation of pills that came out had a high amount of estrogen. They went to a lower amount. And so when the first data came out on breast control, on breast cancer, they kind of said, well, with the new pill, maybe that'll go away. Well, there was a study published in 2017 that included the entire population of Denmark. And they looked at women who had ever, in their lives, ever taken birth control pills. And they showed a 20% increased risk with, very, very precise measurement because there was so many people in the study. Now, a 20% increase may not sound like that much, but when you consider that breast cancer is I think now the leading cause of cancer in women, and that it affects 1 out of 8 women, that 20% risk is pretty big. That's a lot of patients who can get affected by the breast cancer. And so, the data is very convincing. And there's one other thing I should just mention, because I know that the pro-birth control people will tout this, but there was recently a study that came out, I think, of Britain, where they looked at, again, a lot of patients, and they said, well, there's not really a big increased risk in breast cancer. The way that study was done, they enrolled patients I think they stopped enrolling patients in 1970, okay? So all of these patients were over 50 years old by the time they started measuring breast cancer happening. Now, the pill clearly gives the highest risk for causing breast cancer for women who were on the pill or within 5 years of stopping it. That's the highest risk category. And there it's much higher than 20%. I can't remember. I think it might be around 50 or 60% increase in risk. So, they basically eliminated all those patients from their study. And then they come out and they say, oh, look, everything's fine. No reason to look here. Everything looks normal. Very, very deceptive research being done where they kind of hide in their methods the fact that they're not really giving an honest appraisal of the pill's risk.
Wow. Yeah, and I guess since you mentioned the increased risk is when you're on birth control or within 5 years after, and then what if those women go on and have children and do breastfeed, and then that risk may probably drop off there based on the science you were mentioning? That makes sense to me. What a shame that women aren't getting the word on that. I do see in birth control side effect groups on Facebook and other social media sites, women will say, I noticed changes, I have increased, they may notice that their larger breasts or, increased tissue production, things are happening and they're aware of it. And I just try to point out that, yeah, there are changes happening, and you also need to watch out. They could be higher risks with those changes, as you mentioned. Can you say a word on birth control's connections with cervical cancer, speaking of the cancer risk?
Yeah. So there it's much clearer. There haven't been as many studies because cervical cancer is not as prevalent as breast cancer. But there have been, I think, around 10 or a dozen studies, and they all agree that the risk of cervical cancer is increased with the use of birth control pills, probably by about 60%. So it's a very large increase in the risk of cervical cancer. And it's even higher for current use, over 120% increase in risk. And it increases with duration of use. So the longer someone's on the birth control pill, the higher their risk is. And you might say, oh, well, that's because women on birth control pills are more likely to have multiple partners, and that increases the risk of human papillomavirus infection, which is what causes cervical cancer, and that's what the problem is. But in fact, what happens when they do these studies is they take that into account, and they basically match patients with controls so that those things are accounted for. So this is a risk independent of the risk of HPV infection in cervical cancer.
Wow. And that's just fascinating that's much more clear. And I did mean to mention also with the birth control risk that you're right. I think the World Health Organization really recently did announce that breast cancer is the largest cancer for women, and yet a 20% increase in risk overall, or a higher increase in the years of taking birth control or the years following. That's a real big problem. And for other cancers, there's a lot more recommendations. Well, if we can take this out of our environment and reduce our risk by 20%, we'd do that, right?
Right, exactly. Yeah. But
So
for some reason, this is a risk that's ignored.
it just really seems like there's a blind spot here. And the Citizens Petition mentioned to the FDA does share this research, like I mentioned, to the cancerous connections, but also to autoimmune disorders and autoimmune diseases. Can you did talk about lupus? Is there anything else you can add on that, on the different variety of problems that are associated with birth control use?
Sure. So I was talking about patients who have lupus and how it can exacerbate it or cause a flare-up sometimes, or especially people who have antiphospholipid antibody syndrome, where it can cause clotting and increase their risk for clotting. But in terms of predisposing somebody to develop the autoimmune diseases, there's a lot of data that's completely ignored in the prescribing information and the patient information for birth control pills. So, for example, the best studies that have been done show that the risk for developing lupus in the first place is close to double for women who are on hormonal contraceptives. And the same is true for Crohn's disease, which is an inflammatory bowel disease, a very serious disease which can also predispose to colon cancer. And that risk is increased, I think, around 60%. Also, ulcerative colitis, not quite as high a risk, but another inflammatory bowel disease. That risk appears to be increased with hormonal contraceptives. And then other things that may not be quite as clear, like multiple sclerosis, and is clearly a lower prevalence of disease than the other ones I mentioned, but that risk appears to be increased. And interstitial cystitis, which is a relatively common autoimmune problem in women and very uncomfortable, not quite as life-threatening, but that risk is increased. So all of these things are pretty much ignored in the prescribing information and the patient information for hormonal contraceptives. And I really think women deserve to know what the risks they are taking when they start these things. Even if it's something that may not develop right away, it might take years to develop. That risk is still there.
Right, and I just want to remind viewers that at naturalwomanhood.org you can find all sorts of birth control side effects information, and you can search autoimmune diseases and cancers and different birth control risks that are associated. And with those risks on those pages, you'll find all of the studies that are cited in the FDA Citizens Petition. So we've added that recently to the site so that those readers who aren't hearing about it in their prescribing information perhaps can find it. We hope at some point, just before it's too late, because I hate to read the women's stories, which I constantly am encountering, where they say, "Oh, I had this complication. I had a blood clot. My life has changed," and nobody would have chosen to take that risk on. So, a significant portion of the FDA petition paper as well speaks about the economic impact of hormonal birth control. Often we hear in social cultural conversations about economic impact. Well, we're trying to just keep the pregnancies down to avoid, that's economic wording people are often using, but you speak about the economic impact of the hormonal birth control side effects and risks that women are experiencing. Can you tell us about that, how it was calculated, and what it tells us?
Right. So first of all, I just want to mention a couple of other things that we haven't covered here. For example, there is, especially for the progesterone-only contraceptives like Implanon and things like that, the implants and Depo-Provera for that matter, there's information in the prescribing information that says, gee, this may cause osteoporosis. Well, that's true, but there's further data, and not only for progesterone-only contraceptives, but also for the combined oral contraceptives, that not only do they increase the incidence of osteoporosis, but that this actually leads in many women to the development of fractures, vertebral fractures or fractures of the long bones or fractures of the hip as they get older. And so you're taking something that's, with these hormonal contraceptives that are thinning your bone, basically, and predisposing you to fractures. And there's an economic cost associated with the treatment of those fractures. And in the same way, and this is something that Dr. Hannah Klaus worked on, she found a high incidence of depression in women who were taking these agents. And, of course, depression can be, completely life-altering and, very, very serious in women. So basically what we did is we took the information we have in the Citizens Petition talking about the increased incidence of the specific disease. And then we went to the literature and looked at the cost of treating that disease per year above the baseline cost if somebody didn't have the disease. And we basically just multiplied the numbers out. And then we also looked at the number of women on birth control and tried to estimate the actual number of extra cases of these diseases that would be out there. And then, kind of just did the math. And because of that, we could then come up with the economic cost for these different diseases. And just to share a few with you, in the US alone, this is, for breast cancer, there's an estimated excess of cases of 452,000 in the population overall, which leads to an increased cost of $10 billion. For Crohn's disease, there's an estimated increase of 81,000 cases, which costs $1.9 billion. For depression, probably 370,000 increased cases, which could cost over $2 billion. Altogether, our calculation came up with over 1 million estimated excess cases of various diseases, with over 16 billion in cost. And that includes taking into account, and I have to put this information in there to be completely upfront, these contraceptive agents do decrease the risk for some autoimmune diseases and cancers, specifically hyperthyroidism, increased activity of the thyroid, and then uterine cancer and ovarian cancer are decreased. But we factored all that in, including the decreased cost of those and the decreased number of cases in the numbers I just gave you. So even though there are some diseases that appear to be decreased by these agents, there's more that are increased. And the economic cost overall is, I think, staggering.
That is stunning, and I am glad you included, just factoring all that in, and it still shows the larger costs. And that hasn't even, I'm just speaking from my own thoughts here, it doesn't even touch on the poor folks who do suffer from mental health effects and what economic drain that is on their personal lives. I've read many women's stories that, I lost ambition in work, I lost my job, I lost my drive. When you're talking about mental health effects, you can really be affecting people's ability to earn, and women's own, their own earning potential, their own ambitions that they may have. So it just is another page in the story, I think, when it comes to, not helping women in as often as we hear that it is, championed.
Yeah, and if you go to the Citizens Petition website, you can see comments that have been left by various people. Some of them are just heartbreaking, but it includes many women who have commented on these mental health side effects and how detrimental it's been to their lives. And there's another heartbreaking story on there of a man whose daughter died from a severe, blood clotting problem. And the only risk factor she had is she was on the pill. And that was it. So very, very sad testimonies.
It is so sad, right? And I've read some of those myself. We have an article highlighting some of the striking trends at naturalwomanhood.org, but I do encourage everyone to go to the FDA Citizens Petition site, look at the comments yourself. I think they're still open, right? So
yes,
people can still, we're going to include the link here at the end of this in the YouTube video details so you can see how you can participate or how you can go ahead and read. And speaking of that petition, is there any update from the FDA responding or things we can expect to come out of it? And
I mean, I think we're at the 2-year anniversary of having filed that petition in the first place. The FDA did give a required 6-month response to us after it had been up there 6 months, and the response was basically, "We're still reviewing. This is a lot of information. Give us some time." And then, of course, COVID hit, so I kind of was giving the FDA a pass, for last year, figuring that they were very busy trying to get drugs approved for, treatment of COVID and vaccines and all that. But then recently I sent them an email and another letter asking what the story is with that. And I've had no response yet. I do hope to receive a response. But so far they've not really been coming forward with any actions on this that I can see.
Well, while it's still open, I do encourage any woman who've been watching or anyone who knows people who have had birth control side effects to go to that link and to share your comments while it's still open for comments, because that's an opportunity to share your story. It could impact others and help others' lives. And also, Dr. Williams, you're, as I mentioned in the beginning, you're editor-in-chief emeritus of the Lineker Quarterly, which is the oldest continuing journal on medical ethics. Can you tell us a bit about the impact that the journal has and has continued to have on issues touching on these problems?
Yeah, the Lineker Quarterly is really at the kind of the interface between ethics and science, and it's right there where you can see how a ethical approach to medicine has scientific support. And I think that that's a lot of what is published in the Lineker, many articles that tie those two things together. We've had actually several articles published in there with the information on the Citizens Petition. In fact, in the most recent issue, the May issue, we published part one of a 2-part article that talks about a lot of these contraceptive side effects, putting them kind of in one place. We had some previous articles on autoimmune disease and cancer, but now this article includes the bone fracture risks and the depression and some of the other risks that are out there. And so that allows them all to be in one place. And then the next article is going to come out. It's already available online. That talks about the economic and the environmental impact. One of the things people don't realize is that there's been, in the environmental literature now for a couple of decades, data that these hormonal contraceptives, once women take them, they don't get completely degraded in the body. They go out into the waste treatment systems, and that goes out into streams and rivers. And you can actually see downstream from these waste treatment sites that there's feminization of male fish. It's a very strong correlation. So there's a lot of impact that's happening with these things that people just don't know about. And I know you have some things on your website about that as well. It's really important information for people to know.
Right. Yes. Yeah. Natural womanhood. We talk about that too. There's we could see the fish changing, and yet elsewhere in our cultural conversations we hear, let's avoid BPA, let's avoid plastics, things that could mimic estrogens, and yet the things in our own water are the birth control hormones residue and whatnot that you just mentioned is impacting us in ways that when we hear nothing about it, it's everyone's silent about it, but it's the missing, it's the elephant in the room that we are aware of. So you can find more information on that at Natural Womanhood. So let's just shifting a little bit here. Given this knowledge, this extensive knowledge of the health risks you have on hormonal birth control, what can fertility awareness methods, the methods of cycle charting that allow couples to practice family planning in a natural way, what do those do to improve women's health options in your view?
Well, there's just almost too much to cover in a single interview. It needs to be a separate interview, but these fertility awareness-based methods or natural family planning methods have a tremendous impact on women's health in a very positive way. First of all, when women learn the signs of fertility in their own bodies, they can use that to detect the presence of abnormalities sometimes, which can lead to diagnoses, which then can lead to treatments that correct them. The one I think that people talk about the most is endometriosis or fibroids. This is a common cause of infertility in women, and charting can, oftentimes give you a clue that this is what's going on in somebody, and that's where the problem arises, and then it can be corrected. So there's a lot that can be done in that direction. Obviously, you're avoiding the risks of a lot of these diseases that we've been talking about and these disorders by not taking hormonal contraceptives. So there's clearly, an impact there. And then there's also a tremendous amount of data. And one of the things I like to point out, and this is something I think that the Lineker is also very good at pointing out, is that, we're not just mechanical, we're not biological machines. That's not what people are. People are body, mind, and spirit all together in one place. And it's not, like a spirit living in a body. It is a person that is a combination of spirit and body. And because of that, the things that affect us spiritually, and namely either growing in virtue, which I think NFP and fertility awareness-based methods allow people to grow in virtue by respecting their body's natural cycles, but also that, if you're avoiding sin, which quite honestly, hormonal contraceptives, you're sterilizing the marital act. You're taking something that should be life-giving love and making it a mere, vehicle for pleasure, which greatly, and I'm a guy, it really makes it easy for men to use women in a way that no person should ever be used, especially no woman should ever be used. And because of that, if you look at things like the impact on marriage, when women are on contraceptives, the divorce rate is the societal general divorce rate. Over the course of a marriage, I think that's up to 50%. But even for women who have ever used natural family planning or fertility awareness-based methods, the risk of divorce, I think, is cut in half. And if they're faithful to it, it's reduced even further. And I think that's because of the mutual respect that builds up between the man and the woman because of the woman's respect for her own fertility. And so these are tremendous benefits. They go beyond just the medical benefits. I think there's spiritual benefits. There's obviously psychological benefits with the decrease in depression and, I think growth in virtue. And so, again, it's like a whole nother segment would have to be done on that alone, but there's just myriad benefits to women from those methods. And plus now there's apps for it. So it's an up-to-date thing too.
Right. And I do encourage readers to find some of those relationship health articles that we have at Natural Womanhood that explain how the communication's better. Another factor tying in there is it requires both spouses to participate, or to both, partners. Whereas with birth control, it is really a one-sided. Women take this brunt of all these side effects and risks while men don't. And every once in a while we hear some people calling for male birth control, but we should look more deeply at what this problem is. And really a lot of women's accounts that I'm reading is they're taking all these health risks on, including ones that hurt their relationship. They're more irritable, they're depressed, they have less sex drive, and all these different things. And so what are we taking this on for what? So it's not, like you mentioned, it's not bringing, not really edifying the body, the mind, the spirit, and these different factors that are real parts of women's experiences. Well, I'm so thankful for your sharing your insights with us today.
Well, thank you so much, Mary Rose.
Thank you, Dr. Williams. And I hope all of our viewers have found this as fascinating as I have. And I just want to encourage all of you to check out the link to the FDA Citizens Petition, which will be with this YouTube video in the details below. And also for all things fertility health and all the modern, effective, natural family planning methods, check out naturalwomanhood.org.